Welcome to THY Vlog channel. Mechanical or obstructive diseases. Congenital. Etiology and signs. Congenital disorders, including pharyngeal cysts of respiratory epithelial origin, nasal cysts, cystic nasal conchae, skull anomalies, laryngeal malformations, and branchial cysts, have been observed in calves and adult cows. Inspiratory dyspnea with audible snoring sounds or stertorous breathing is a sign common to most of these problems. The condition may be present at birth or is most often observed within the first few months of life. The degree of dyspnea associated with these abnormalities tends to be progressive as a result of either enlargement of the lesion, cyst, or worsening upper airway edema and swelling from the mechanical overwork associated with respiratory efforts to move air through an airway narrowed by a malformation. Environmental conditions of high heat and humidity may markedly exacerbate the dyspnea. Diagnosis. Specific diagnosis requires physical examination, including visual inspection of the nares and oral cavity, endoscopy, and skull radiography. In addition, aspiration for cytology and cultures may be indicated for cystic lesions. Most cystic lesions become secondarily infected. Treatment. The method of treatment depends on the specific lesions found. Cystic conditions may be the most treatable because surgical removal offers some hope of being curative. Simple drainage or drainage with cautery of cystic lesions is not likely to be successful. Therefore, referral of such cases to veterinary surgeons experienced in upper airway surgery is recommended so that complete excision of the secretory epithelium can be completed. Other conditions such as laryngeal malformations and skull anomalies have a poor prognosis. Regardless of the cause, symptomatic or supportive treatment may be necessary before diagnostic procedures are performed in calves with severe dyspnea, lest the stress of examination or endoscopy induce anoxia. A tracheostomy should be considered to allow safe diagnostic manipulation. Misinterpreting anoxic patients struggling as wildness requiring additional physical restraint is a frequent and potentially fatal error in judgment made by inexperienced clinicians. When a dyspneic animal struggles during examination, usually it is anoxic, frightened, and extremely anxious. All restraint of the head and neck should be relaxed, and the animal should be allowed to get its breath. Continued restraint during these situations may result in asphyxiation of the animal. Although the prognosis for congenital lesions varies with the specific diagnosis, generally it is guarded to poor. Thank you for watching and see you again.